Medical news to get to. This morning, there are new changes to vaccine recommendations from the CDC's advisory panel.
Yeah, that includes guidance on COVID shots and childhood vaccines. And to help us understand what this means for us and for families, we're joined by Dr. Catherine Troisi with UT Health Houston. Did I pronounce that correctly?
You did, yes.
Okay, great. I try really hard. So we want to know, the panel now says people should talk with their doctor if they want a COVID vaccine instead of just recommending broadly that everyone 6 months and older get one. So why that shift? What do we understand about that?
Yeah, it's actually very confusing because the FDA regulations, if you remember, that came out a few weeks ago, I guess, said over 65, fine, you get your shot. Mm-hmm. Under 65, that you needed to have a high-risk condition. This, or a provider could give it off-label.
Got it.
So this recommendation says anybody can get it, but you need to consult, even over 65, with your healthcare provider.
Oh.
What does that exactly mean? You don't need a prescription. They did not vote for that. But do you have to have another visit to talk to them? Most people get their vaccination. Last year was 2/3 at pharmacies. What does it mean about getting a vaccine at pharmacies? Do you just tell the pharmacist, yes, I talked to my healthcare provider?
Right.
Yeah. A lot of
the
confusion
honor
there.
System. Okay,
Right.
so we certainly need more clarity on that. If you have
Yes.
to jump through more hoops, we're certainly going to see those numbers go way down of people that are getting the vaccine. Okay, let's also talk about the panel voting to separate the measles, mumps, rubella, and chickenpox vaccines, okay, for kids under the age of 4. Is there a medical benefit to separating these out or delaying one of them?
Yeah, in terms of practicality, only about 15% of children under age of 4 got the combined vaccine anyways.
Okay.
It won't make that much difference. There is a very small increased risk of a febrile seizure, having a high fever and a seizure. If you got, for children between about 1 and 2 years of age, if they got the combined vaccine, very small risk, usually no consequences. So now, that vaccine will not be available to children under 4. It won't be paid for if you're in the Vaccine for Children program, which is about 50% of our children. But in practice, probably won't make that much of a difference.
So MMR will still happen when it used to, but the chickenpox vaccine is the one that's going to be delayed till later. Is that right?
No,
No,
it's
okay.
just 2 separate shots instead of 1.
Okay, so all of them are waiting until 4 years or older. No, or is it just a separation?
It's just, so there's the MMR V or separate is recommended at 12 to 15 months. So that will be 2 shots. Once then the second dose is 4 to 6 years, that can be combined or 2 separate shots.
Okay.
Yeah.
I mean, thankfully our pediatricians will follow this and kind of guide us into hopefully what we should be doing, because
Right.
it is really, it's confusing.
I know. What's the bottom line then for families? What should they take away from the vaccine changes? Except, talk to your doctor about what's best for your family.
I think that's it.
Yeah.
Talk to your doctor. Now, unfortunately, about 30% of Americans do not have a primary care physician, which makes it a little harder.
Yeah, I think I'm one of them.
Yeah.
I need to get one, because you do need somebody to ask all these questions to.
Yeah.
All right, doctor, thank you for coming in
Thank
and trying
you.
to kind of unpack all of this
I
for
know.
us. We appreciate it.
When we come back, the